we have gone through. Kadin has opened registration for companies who are interested in participating, and until today, there's about 22,700 companies with about 10.5 million participants that have been registered through Kadin for the Gotong Royong program.
All right, Ibu Sinta, from our understanding that there will be two types of vaccines that will be available for this Gotong Royong program, which are Sinopharm and CanSino. Are both vaccines already available at the moment?
At the moment, only Sinopharm that has been supplied in the first batch, about 500,000, in which it was split up between private companies and also state-owned enterprises. So, explained before, 75%, 25%. So actually, until today, only Sinopharm. CanSino is not available yet, and I think the government is still trying to procure that.
Now, this program, as we understand, is for any company in the country that wants to vaccinate their employees, but of course they need to buy it with a certain price. Well, not all companies can afford it. What's your take on that?
Yes, so from the beginning, I think it's very clear that due to COVID, many companies are impacted, and many companies will not be in the position to purchase vaccine for the employees. But despite that, there are still companies, and this is why we have huge interest, who feel and who believe that they need to spend for the employees to protect for their health, because vaccination is very, very important in order to control the pandemic. So I think businesses believe that in order for government to also achieve its herd immunity, which is 70% of the population being vaccinated, there needs to be support also from the business side. And this is why the idea of vaccination Gotong Royong came from Kadin in order to support the government to achieve that herd immunity. So this is voluntary. For those companies who can't afford it at this point, because many, of course, like in the tourism industry, like hotels, retails, maybe transportation, many are impacted, may not be in the position to purchase vaccine. Thus, they can, of course, follow through the free vaccination program that has been rolled out by the government. So this is an option. It's optional. It's not mandatory. Only for those companies who are willing to spend for their employees, and they cannot charge anything to their employees. So it has to be the full responsibility of the company to buy vaccine and vaccinate their employees.
All right, Bu Sinta, how are the companies and businesses responding to the vaccination program, to Vaksinasi Gotong Royong, and especially to the price that is given according to the vaccination, which is that you have already mentioned before? And can you also tell us more on how the vaccination program will impact the businesses, especially in terms of economic recovery?
Yes. So actually, from the beginning when we did the registration, we also did a survey for companies in terms of the price limit and how much they would be willing to spend. And I think the price that has been issued by the government are acceptable to most of our companies that would be want to participate, and thus we can really see the enthusiasm of companies to participate by the registration process. So definitely, so far the price is acceptable to most companies. Although I said for those companies who can't, who feel that the price is too high or who would not want to participate, they can still follow the free vaccination program. I think for many companies, when we go through COVID, we have spent a lot of also for spending for, following the health protocols. We have to spend also for testing and so forth. This is quite significant amount. So we really believe that following health protocol only is not sufficient. There needs to be a successful vaccination program. And we really believe that this is really the key to the economic recovery. Because if the government can't control COVID, it's very, very difficult, even if the government gives all the stimulus, do more structural reform, for us to really boost up back our economy. So I think this is a game changer. We need the vaccination program to be successful, and thus the idea of Gotong Royong is participation of many stakeholders in terms of reaching the targets that the government wants.
Okay, so the number of vaccine supplies and the number of companies participating in this program, how will that be in line with the government, the government's overall quota of people being vaccinated in the country?
Yeah, so the total number that the target of the government is 181.5 million for 70% of the population to be vaccinated. And out of that number, 20 million will go to the vaccination Gotong Royong. So that's kind of roughly the target of the government. Of course, we will have to see also the continuation in terms of supply, because this is not, this is completely separate. The free and the paid vaccine are completely separate and different vaccine. And we cannot also use the facilities of the government, the healthcare facilities and so forth. So that really has to be separate. So that's why we need to be able, the government, to Biopharma, needs to procure sufficient vaccines also for the Gotong Royong program. So I think this is hand in hand. We believe this is the fastest. I mean, government wants to achieve this target from 12 to 15 months. So that means we have to vaccinate at least 1 million per day. So that's not an easy number. It's a far-reach target, but I think slowly we're getting there.
I do hope so too. All right, thank you very much, Bu Sinta, for spending time with us tonight. Bu Sinta Wijaya Kamdani, Vice Chairwoman of Indonesian Chamber of Commerce and Industry, or KADIN, joining us here on Asia Prime concerning the Gotong Royong Vaccination Program.